and we understand the signs that tell us when we should be concerned. So, if you have cervicogenic headaches, you know they can be quite debilitating and they can really stop you in your tracks, especially as an executive mom when you're balancing your work, your career, your kids, everything, and then you have a headache on top of it can be quite challenging. So, to deal apart from the fact that these headaches are quite challenging, when do you know that you should be concerned or worried about a cervicogenic headache? Because, firstly, if you have a cervicogenic headache and you're worried about it, well, first know why you get the cervicogenic headaches and what can you do to manage these. But there are some signs and symptoms that do indicate when you need to go back to your doctor and have them looked at. So, in today's video, let's talk about the symptoms that can be a cause of concern with cervicogenic headaches. Now, before we get into the topic for today, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is, back and neck, and nerve pain. I do this by giving you simple exercises, some lifestyle changes, some tips and tricks that have worked for me in my own pain journey. So I do all of this without taking away a big chunk of your time because, hey, we're moms, we're busy people, right? So let's get back into the topic for today, which is understanding the signs that is when you should be concerned or worried about your cervicogenic headaches. So the very first one is if you have a sudden onset of pain or cervicogenic headaches after a trauma or injury. Now, this is especially true if you've been in a vehicle accident or a car accident and you've had a whiplash injury, or you have a headache that suddenly develops within like a few days of even a few hours to a few days of being in a trauma or an accident, now, or an injury for that matter. Now, actually, before I jump on to the second one, the second reason or sign when you should be concerned about your headache, let me just give you a very brief idea about what are cervicogenic headaches. So, our cervical spine is divided into these seven vertebrae. So, starting from the base of your hairline down to where your neck meets the shoulder. So in the middle here, there are seven cervical vertebrae. On either side of the spine, along those vertebrae, there are nerves exiting the spine. So basically, you've got these eight nerves coming out from your neck and the upper two mid cervical spine. So basically, from your hairline to the middle of your neck here, if you the nerves that are coming out from this area, they usually go and supply the back of your head and the side of your head here. So if these nerves are getting irritated or pinched, you can get headache type of symptoms. And because they originate in the cervical spine, because of the nerves being irritated in the cervical spine, they're known as a cervicogenic or cervical headache. Now, typically, cervicogenic headaches would be accompanied, well, they can go without as well, but usually they're accompanied by neck pain or some problem in the neck, because of which you have that irritation of, or pinching of the nerves. And then this headache typically goes from the back of the head and onto the side, and it can go even behind your eye socket or into your TMJ, that is this jaw temporomandibular joint here. And sometimes you can feel it deep into your eyes as well. If the nerves are getting irritated on one side, you will have headache on that side, or it could be bilateral as well. One side may be more or less than the other, it could be just one sided. So these are some of the symptoms that will help you to differentiate these from tension type of headaches or migraine headaches, which tend to be more bilateral, as in both sides. And your tension headaches tend to be more frontal, so more in the front and the middle of the head here. Anyway, so if you want more details on cervicogenic headaches, I've done a couple of videos on this, actually quite a few videos on this. And also I talk about the management of these headaches as I deal with nerve pain and neck pain as well. So if you want to know the more details, you can go to my YouTube channel and have a look there, or you can just go to YouTube, type my name, Swati Prakash, headaches or cervicogenic headaches, and you'll be able to come up with these videos. Alrighty, so going back to the signs that should be a cause of concern with your cervicogenic headaches, the first one we discussed was sudden onset of headache after trauma or injury. The second one is, just looking at my notes here, so if you see me looking away from the screen, that's what I'm doing, increased pain intensity. Now, if you have had cervicogenic headaches, you know they can be quite intense and debilitating. However, if there is a severe pain in your head, neck, or shoulder area for that matter, I know I said it was more mid to upper to mid cervical spine, but sometimes the neck gets so stiff that you can have pain radiating down as well. So if there's an increase in the pain in your head, neck or shoulder area, and it is not going away with over the counter medication or the medications that your doctor has given you or your physical therapist has given you, exercises, basically anything you do does not decrease the intensity of the headaches. In fact, the intensity is constantly increasing. Then maybe it's the time to go and have them checked out by your doctor. The next one is if there is a change in the pattern of your pre-existing headaches. So, for example, the headaches that I used to get was neck stiffness, especially if I had slept in a wrong posture at night, and then they would creep up the side of my head and into my temple area here, and sometimes into my TMJ. So, thankfully, I don't have that anymore. But when I used to have that pattern, there was like a certain way the headache progressed. So once you have these headaches, you know exactly what your pattern of cervicogenic headaches is. So if there's a sudden change in the pattern of your headache, so for example, the type of headache, the intensity of the headache. By type of headache, I mean whether it's a throbbing headache or it's a dull, achy headache, or it is basically the symptom of the headache is different, and if it is more severe, it is more frequent, it is coming back more frequently than it usually does, maybe it's time to go and have a quick word with your doctor. Another thing is chronic or recurrent cervicogenic headaches. Now, if you had headaches, and like for me, I know if I sleep in the wrong posture, I used to get those cervicogenic headaches. But if I have not been in a wrong sleeping posture, and I have not strained my neck at the night, and I'm still getting those cervicogenic headaches, maybe there's a new cause for my cervicogenic headaches. However, it is better to have it ruled out by the doctor to say that no, it is just cervicogenic headache and nothing else, because headaches can have many many reasons, this the neck being one of them. So if there's anything else that happening around, say, your eyes, your brain, or this full area, and you keep thinking it's a mycogenic headache, whereas something else is more sinister, you probably want to have it checked earlier than later. Now, in conclusion, cervicogenic headaches can be quite debilitating and they can significantly affect your daily activities. However, recognizing the signs that warrant concern um, are crucial, especially for early intervention and basically for your peace of mind. Because if I was having any of those symptoms, I would definitely not be very comfortable, and I would love to get, I would actually like to go and get them checked out. All right, so there are other cause I mean, there are other signs that do have warrant early intervention and need to be looked at, or is advisable that your doctor looks at them. However, I'm not covering them in this video because these are the common ones, and these are the ones that people usually recognize on their own once they are aware about it. So if you are looking for more details on cervicogenic headaches or the topic for today, you can have a look at the blog that I have written, that which is when should you be concerned about your cervicogenic headaches. I will leave a link to that blog in the description of this video. If you're watching me on Instagram, the link will be in my bio. If you're watching this in the near future, or you're not watching it today, then maybe that blog is lower down and you can't find it, then you can just message me and I'll send it across to you. Oh, yeah, the blog also has a free guide on if your neck is the cause of your headache. So, if you're not sure whether you have cervicogenic headaches or not, this is a guide that will take you step by step, and it'll show you, it'll be able to tell you whether you have cervicogenic headaches or uh, it is basically another cause of your headaches. Alrighty, I hope that was useful for you. If you have any questions, any concerns, do let me know and I'll address them for you. And I'll see you guys next time. Bye for now.